Hello, my name is Deanna Aldridge, and I'm presenting you with my Nursing Innovation Education project that I am doing with the University of North Carolina at Wilmington during my Masters of Science in Nursing and Education project. This project is being implemented at Fry Regional Medical Center, located in Catawba County, North Carolina. My preceptor is Heather Vest. She's a doctorate of nursing practice, a nursing educator at Foothills Nursing Consortium, and an active member on the maternal unit at Fry Regional. Also, her supervisor and department manager, Michelle Woods, is involved in assisting with coordination of the educational department to hopefully expand and roll this out to more nurses. The plan is to implement this via electronic, virtual, using a PowerPoint assisted lecture. However, I can live instruct using Microsoft Teams, which is a online platform much like Zoom, and that is how I have been communicating. The participants are labor and delivery nurses currently working on a full-time basis within the labor and delivery unit at Fry Regional. And the basis for this project was developed during the learning needs assessment, where none of the nurses had ever recalled caring for a woman that had veteran status. However, during our conversations, we determined that that's not something that was asked. So they were unable to really identify these women. These women are not going to often give that information freely if not asked, and they are often not identified because they are not going to present in military attire, and often come in with a lot of comorbidities. It could be physical disabilities from injuries they sustained during military. It could be psychological, PTSD, military sexual trauma. Any of those things can increase their risk for complications. PTSD especially increase their risk for preeclampsia, diabetes, and preterm birth. Identifying these women and ensuring that they are properly cared for and their care plan is tailored to their needs is very important. And that is what this educational innovation is about. The evidence support this, noting that there are an increased number of women veterans now in our military services. A lot of those women are of childbearing years, and so the number of women using VA services has increased over the years and will likely increase further in more years. 9.4% of our veteran population are women, which equivals to 1.9 million. 26.4% of those are of different races other than Caucasian. And as we know, the increased risk of ethnic population increases maternal mortality. There are lots of health disparities associated with this as well, based on living conditions, whether they are in rural or urban areas. Preterm birth for women with PTSD goes up to 9.4% versus those who do not have a PTSD diagnosis is only 7.4% per 1,000 veterans only. Preeclampsia, 4.5% for non-PTSD mothers and 6% for PTSD mothers. Gestational diabetes, 4.6% non-PTSD and 6.7% for our PTSD mothers that are vets. So there's definite need for education and identification of this at-risk population. Our outcomes are to increase awareness that veterans are higher risk, especially those with PTSD, and to tailor our care plans of these patients while they are inpatient and follow those resources that we're going to set them up with into the outpatient setting so that their care continues on once they leave our eyes. We are going to do assessments with our nurses that are included in this innovation, and those will include short-ended essay type questions that I have developed will allow them to utilize their critical thinking skills and give a subjective approach to the care. Also, they will be given a multiple choice test, 10 questions, 80% pass rate, and also some simulation-based learning using case studies with a skills checklist attached to that. Our evaluation of the program will be done post-test. They will evaluate my teaching strategies, things that they would like to see in the program, things that maybe weren't so beneficial, ways to improve, and then we will tailor this innovation based on recommendations after evaluations are done. Thank you so much for listening. I appreciate your time.